be a good amount of questions on your final exam, but most especially on. So this is a sample prescription, and this is the information of the doctor. Andrew Smith, MD. The doctor's information should have his or her clinic or office address, not the home address. Okay, should have contact information as well. Next one, a prescription should always have the date. So this is date part. A date should always have month, day, and year. If it doesn't have the year, it's not a valid prescription, because there are rules pertaining to dispensing prescriptions. Is that clear? This was part of the question on the PTCE. One thing you should never do in the pharmacy is assume. Never ever assume that that is a milligrams, written in milligrams, that mg looking like an mg is milligrams. There are rules, regulations we set in place so that we can minimize medication errors. And this is what we're going to be talking about in the next couple of days. Never ever assume. So if it doesn't have a date, don't assume that it's written the current year. It's not a valid prescription, because a prescription may look brand new. However, it was written last. Okay. There are rules pertaining to prescriptions as to how long is this prescription valid from the time the doctor wrote it. That clear? So this one. And then here comes your patient. Patient's name, patient's date of birth. Usually you don't see that on a prescription that is given to the doctor. Okay. And then the doctor puts the information, or the pharmacist asks date of birth or asks for your insurance card, all that information. But not all prescriptions will have the patient's address. Okay. Patient's address is a must by law if the prescription, the drug written, or the prescription is a C2. But nowadays, because of our abuse problems, they wanted the address written if the prescription is a narcotic in general, all controlled substances. That always comes up on the PTCE, always. I'll talk about filing. Some states would like you to file prescriptions for 2 years, controlled substances. Like federal has a different rule. When that differs, you follow whichever one's more stringent. It doesn't mean that federal is higher. We always follow federal.